Anthony DeSena, Chief Development Officer here at Redefine Management. I lead the charge on mergers, acquisitions, and integrations here at Redefine Management. Redefine Management partners with a multitude of specialties within healthcare. We work with groups in pain management, spinal surgery, orthopedics, podiatry, mental health, primary care, getting into worlds of cardiovascular, orthopedics as well. My day-to-day work here is to build out new markets outside of New Jersey area, so looking into other states that could use our services for management and growth. So our partners have to be aligned with us culturally, right? So we are a patient-first, provider-centric management company. Our leadership team consists of clinicians and physicians, so we understand what the patient experience needs to look like from not only the clinical provider side, but also from the patient side. So that is first and foremost the most important there. We also only look for groups where we feel we can add value. So groups that are really in line with where we are, but just need a little bit of extra horsepower to get them there, and that are so busy seeing patients that can really just use some help to get some efficiencies operationally, financially, and benefit from some of the relationships that we've made and the lessons we've learned along the way. Redefine is different than other growing healthcare organizations in a few ways. The first one is we are physician-led and privately owned, so we are able to make our own decisions and invest and do partnerships in ways that we see the best fit for us. We also have a partnership track where you maintain the autonomy of your practice. Clinical practices and operational practices of your business stay the same. We come in to provide help where it's needed, provide increased support where needed. From a deal perspective, we're a little bit different in the sense that we are building a partnership model on our way to a bigger event. So in part of that, every group that joins us is not completely bought out, but a partner of our organization. The partnership process here at Redefine Management is a bit different. We like to keep it simple because we understand as clinicians that doctors are very busy. So we try to do a really smooth process. It really starts with an initial conversation where you get to know us and we get to know you. And if we think there's a fit there, then we start the process. And really what it starts with is non-disclosure agreement, which just says we're not going to share each other's information. We take a look at your business. We ask for a pretty short list of items that we need for some financial due diligence. We do this not only to learn, but to see where we can add impact. If we don't think we can help your business or your practice, we typically don't. We try to put ourselves places where we're not needed. So upon assessment, 10 times out of 10, we usually can help. There's a lot of things we can help fix. And then from there, if the practice likes what we're saying, what we do is we offer a term sheet that says kind of lays out all the ways in which partnership will work and a little bit of a background on our company. So your advisory team of lawyers, accountants, and such can look at that. From there, we get into the next level of diligence, which is a bit of a deeper dive and really get to know the practice. We don't just do this through Zooms and emails. We actually come on site, get to know the facility as much as we can. If all is still there and all are in agreement, then we move to definitive documents. As that is being worked on in more of a legal sense, our integrations team fires up. And they start to come in and really start looking and thinking about the ways that when the deal is consummated, how will you plug into Redefine and how will Redefine plug into you? And that's probably the most important part, I feel. The stuff before that are the things you have to do, but the integration and making sure that we can do the things that we said we could do are crucial to us.